Hello, everyone, and good afternoon. Welcome to the CalAIM Funding Opportunity to Build Capacity and Infrastructure webinar. My name is Megan Morgan. I'm here from the California Department of Aging, just to go over a few meeting logistics with you. You can join by smartphone, tablet, or computer. You can also join the audio by telephone only by entering the meeting ID and the passcode. Live captioning is available. It's accessible via webinar and through Zoom, and captions have been enabled simply by toggling on your screen. This recording will be posted to CDA's YouTube channel after its conclusion, where you can refer back to it, and we'll be sending it out in our weekly updated emails. There will be a question period later on in the meeting. 20 minutes of time is reserved, and 2 minutes is allocated for each question. So attendees who are joining the webinar by Zoom can use the Q&A function, which is at the bottom of your screen, or you can select the raise hand icon. And then the moderator at that time, Sarah, will announce your name and unmute your line. If you're joining by phone, simply press *9 on your dial pad to raise your hand. And then the moderator will again announce your name or the last 4 digits of your phone number and be able to unmute your line. If you have any additional public comments that are not able to be addressed during this meeting, simply email us at communications@aging.ca.gov. And now I will turn things over to Susan DeMorris, our director here at the California Department of Aging.
Thank you, Megan, and good afternoon, everybody. Thank you to all who have joined this afternoon. I can tell this is an important topic when there are basketball games tonight, and it's 85 degrees in some parts of our state, and here we are, 150 people wanting to learn more about how they can participate in and engage in CalAIM. This is one of the key objectives of the Master Plan for Aging and our new initiatives for the 2023-24 fiscal year. And it's a very timely topic as everyone's focused on the budget process and the legislative process. Here's something that we think is very important for you to know about that was established last year and is active right now through May 31st. So it's very timely for you to tune in, and we're just so grateful for our partnership with the Department of Healthcare Services and Susan Phillips' leadership on this topic. And she's a fantastic resource and teacher to us at the Department of Aging, and I know that she will be for you as well today on this webinar. After we hear from Susan, we'll be privileged to hear from 3 panelists. Thank you all for giving your time today to share what you've learned thus far from your experience contracting with CalAIM and as awardees for the PATH funding. So I don't want to talk any longer. I want to turn it over to the expert in the house, Susan Phillip. Thank you again for joining us and presenting today.
Great. Thanks so much, Susan. And thank you all for having me today and for joining on a Friday afternoon. Really appreciate everybody's interest and time. So as Susan said, I'm going to provide an overview of an initiative called PATH, which is a major initiative under CalAIM. And we can go to the next slide. So first, what I wanted to do is provide some quick overview of what CalAIM is, which is really our broader Medi-Cal transformation efforts. I want to talk a little bit about other initiatives under PATH. I'm going to go over 3 key initiatives and really spend most of the time focused on an initiative called CITED. So yeah, we can go to the next slide. All right, so for some initial context, so at the Department of Healthcare Services, we are really undertaking a broad Medi-Cal transformation effort, which is called CalAIM, stands for California Advancing and Innovating Medi-Cal. And really, you know, or fundamentally, the idea is to transform Medi-Cal from kind of a traditional notion of a healthcare system that might just focus on providers, but really to ensure that we are incorporating an array of partners into our delivery system. So really bringing in community-based organizations and social services partners to really provide that whole person care. So the whole idea here is we're really taking a fundamental approach to transforming how Medi-Cal program functions and how care is delivered. And really take that whole person care approach to address social drivers of health, improve quality outcomes, and reduce healthcare disparities. And we really looking to, throughout that whole entire transformation effort, really keeping an eye on what is our members' experience and making that more seamless in the process. So we can move to the next slide. So just one thing I did want to mention, as Susan said, we started this last year, kicked off January 1, 2022. It's definitely a phased approach. I'll get into the details there. So we really are building the plane as we are flying it, so to speak. And so I just want to emphasize that, we really need engagement of our partners who serve our Medi-Cal members in the community, really need engagement of our partners. And for those of you who are already engaged and implementing these key initiatives, we need to hear from you on how it's going and making sure that we're hearing that feedback to help to smooth out implementation experience for our providers, our managed care plan partners, and most importantly for our members. So I just wanted to emphasize that. Okay, so really quickly, two key initiatives, enhanced care management, community supports. Both of these are being implemented within our managed care program. Just as a reminder, Medi-Cal is mostly administered through our managed care program. Come 2024, 99% of our Medi-Cal beneficiaries will be enrolled in a managed care plan. So our plan partners are a big part of our initiative. And so ECM and community supports are really a couple of the key initiatives to go live under CalAIM. So I want to spend a couple of minutes about each of those. So first we'll go to ECM, go to the next slide. Okay, so enhanced care management is really a new Medi-Cal benefit. The idea here is that enhanced care management is designed to support a comprehensive care management approach for our members with the most complex social needs as well as complex health needs. So, consider members that really have high needs that must engage with multiple delivery systems to access care, including primary, specialty care, mental health care, long-term services and supports, and then of course, social services. So ECM is really designed to provide that intensive care management approach. And again, it really is intended to address both the clinical and non-clinical needs of our highest need enrollees through that intensive care coordination. Okay, we can go to the next slide. So we have taken a phased-in approach to enhanced care management, and the phase-in is really structured according to what we're calling populations of focus. Recognizing that we can't do everything all at the same time. We first went live for specific populations of focus January 1 of 2022. First for all of the individuals that were in these pilot initiatives that were before CalAIM started under whole person care and health home programs. Those folks were transitioned come January 1, 2022. And then adults and families experiencing homelessness, adults at risk for avoidable hospital or emergency department utilization, adults with serious mental illness or substance use disorders. That all went live January. And then earlier this year, the population of focus that went live is really focused on those individuals that are living in the community and might be at risk for institutionalization or eligible for long-term care institutionalization. And then we also are focused on the population that are nursing facility residents, but could transition into the community. And then this coming July will also be focused on children and youth population of focus. So that will be going live this July. And then January of 2024, we're focused on a birth equity population of focus, and then really scaling statewide population of focus for individuals that are transitioning from incarceration and for our justice involved populations. Okay, we can move to the next slide. Okay, so this just provides a flavor of the folks who are, you know, kind of can be ECM providers. So this is a pretty long list, and I would say not every organization or entity that might fall in this list might, you know, be able to provide ECM level of services. You know, as I mentioned, ECM is really designed to provide that intensive and comprehensive care management approach. So there are a few core services that ECM providers need to be able to provide. For example, outreach and engagement, comprehensive assessment, care planning, really being able to provide that coordination, not just among healthcare services, but also among that social support services. And, you know, and also being able to provide health promotion and education to really enable members to engage in their own self-management. So there are some core capabilities that ECM providers must have to really be able to deliver ECM. But this gives you a full list, and I just wanted to highlight, you know, there's quite a large number of provider types that are participating in ECM now. Okay, we can move to the next slide. So I will now switch gears to community supports. So this is also a foundational initiative under CalAIM. And community supports refers to 14 services really designed to help address social drivers of health and advance health equity. So these services are considered medically appropriate and cost-effective alternatives to medical services. So, and unlike ECM, which is a benefit that all managed care plans must offer, community supports Medi-Cal managed care plans are strongly encouraged, but not required to provide community supports. As I mentioned, community supports is really intended to be medically appropriate and cost-effective alternatives to other services, such as, for example, emergency department use or admissions into a hospital or a skilled nursing facility. Okay, we can move to the next slide. Okay, so this is a list of the 14 pre-approved community supports. We have on our website, I won't go into that right now, but on our website, we have a really detailed community supports policy guide that talks about, you know, what specific services are included under these different buckets, what providers are eligible. We also have on our website a list of all of the managed care plans that have offered these specific community supports by county. So go and check out the county and then the managed care plans that are offering the community supports. Okay, we can move to the next slide. So this slide provides a non-exhaustive list of community support providers. So this is really just to say that, you know, a number of entities can be considered community support providers as long as, you know, they could provide that specific service. So could be community-based organizations, and this lists out kind of CBOs that we are seeing already participating in the space, and then local governmental entities, including our county partners, local public health jurisdictions, and social services agencies. Okay, we can move to the next slide. Okay, so now I'll switch to PATH. So just really quickly, the whole idea of PATH is, you know, we know there's a transition period, right? What we're trying to do here is build capacity in our delivery system. And we know this whole notion of bringing in new and different provider types into our delivery system and really embedding them as part of our delivery system is going to take time and effort, and also funding. So PATH is really available to our providers, and it's $1.85 billion initiative to maintain, build, and scale the capacity to build out CalAIM. And it's really designed to focus on ECM and community supports, and the dollars are to flow to CBOs, providers, local governmental entities, our tribal partners. So really focused on entities that are providing the services. Managed care plans are not eligible for these funds. Okay, we can move to the next slide. So this provides a quick snapshot of key PATH program initiatives. I go to the next slide. I want to touch base on two. First, collaborative planning and implementation. Then I also want to talk about technical assistance marketplace. I'll highlight those two, and then spend most of the time that I have left on CITED. So really quickly, collaborative planning and implementation is really an initiative that launched earlier this year, and it's planning efforts. So it's designed to support local collaborative groups to get together to identify gaps and needs related to CalAIM, to identify and resolve implementation issues and share promising practices. So the whole idea is for there to be a forum for organizations and entities at the local level to come together and work together on implementation. So there are 25 county regional collaboratives, and the facilitators have been selected by DHCS. They have some key milestones, including monthly meetings. So there is a forum. So I would encourage folks to really check out the local collaborative. There's a website link right here on this slide. And, if you're interested, join the collaborative planning meetings. And it's a great forum to meet others and really share needs and the work that you're interested in doing as well. Okay, we can move to the next slide. Okay, so the next initiative I wanted to touch on is a technical assistance marketplace. So this initiative is really focused on providing a space for entities that are interested in getting technical assistance. So this just launched earlier this year as well. And this allows direct provision of dollars to entities that are intending to provide ECM and community supports, and where they need that hands-on technical assistance support from vendors. So DHCS has, working with our third-party administrator, has vetted and reviewed all the vendors that are currently on the marketplace. So go to the website, you'll see the vendors that have been listed, organized by domains, and then you can click through and then see, who are these potential vendors, what kind of services are they providing, and you can also raise your hand through by clicking through and request for specific TA services. So I definitely want to encourage folks to check out the TA marketplace. The website link is here. Just a couple of domains, for example, would be like building data capacity, for example. If you're looking to understand how to really collect data, manage data, share data to really enhance community supports or enhance care management capabilities, then there are the vendors that could provide that service. If you're looking, say, for example, for some technical assistance on how to engage with Medi-Cal managed care plans and develop those contractual relationships, for example, there's technical assistance vendors that can help support with that. So those were a couple of examples of projects you could undertake. Okay, so wanted to switch to CITED. So CITED is the goal ultimately of CITED funds is intended to build delivery system capacity, for ECM and community supports throughout California. So this provides direct funding to providers for capacity and infrastructure. And there was a round one that was open last year. And we awarded a total of $207 million to 137 organizations in round one. So as Susan alluded to earlier at the beginning of this webinar, round two is now open, opened at the end of February and will run through the end of May. Okay, we can go to the next slide. Okay, so just want to give a quick overview of, who got round one funding. So this provides a breakdown, if you will, of the round one applicants that were awarded funds. The first table here provides a breakdown of what we're calling permissible use categories. And so we have awardees that are really focused on increasing provider workforce related to ECM and community supports. The next bucket of awards were really focused on building IT and data systems to support ECM and community support. So it could be either modifying or purchasing or developing the necessary IT infrastructure for billing and data systems, for example. And there's a number of other awardees, which I won't get into detail here, but this is just to say that there is a diverse number of applicants that were provided funding under round one. I will say that in terms of the entity types, we had most fell in the CBO bucket, so community-based organizations. The second were, more traditional providers, hospitals and other healthcare providers. And then we had our local governmental partners. I will say that we did not have any applicants that fell into the tribal or designated Indian health programs. And so as part of round two, we're really focused on ensuring that we're doing outreach and receiving applications from interested folks in that category. Okay, we can move to the next slide. Okay, so this also provides another breakdown of round one. And this kind of provides you a list of, if you're taking a look at the populations of focus, as I mentioned earlier, under enhanced care management, or if you're looking at any of the 14 community supports, it kind of breaks it down into the awards that were focused in these two categories. So I will just note that since, one entity or application could fall into multiple populations of focus or provide more than one community support, the totals are not going to add up here. But I thought it would be helpful to share some detail as to what capacity is being built up by the awardees under round one. So this to me is very exciting when you see just really the take up of the different services that are being awarded and being built up by our awardees. Okay, so now I'm going to get into the cited funding awards. Go to the next slide, and who qualifies for cited funding, and just some quick tips for the round two funding. So first, I would say applicants that are receiving cited funding, one of the criteria is that they do need to be either contracted to provide ECM community supports with a Medi-Cal managed care plan, or have a signed attestation form to provide ECM and community supports. So, recognizing that, not necessarily going to have a contract with a Medi-Cal managed care plan on day one, but there should be a plan to have that, because the whole idea for cited funding is we're building capacity, right, for ECM and community supports. So this slide reiterates the different types of entities that could qualify for cited funding. Okay, we can go to the next slide. And this provides a little bit more detail about the permitted uses of funding. So the breakdown slide that I showed earlier kind of showed different buckets of where people had focused their first round of funding. And this provides just a quick flyover of the different types of permitted use. So for example, under provider workforce, cited funding can be used for hiring, recruiting, onboarding, or training staff that will have a direct role in the execution of ECM and community support services. In terms of infrastructure, as I mentioned earlier, the dollars can be used to, say, for example, to build infrastructure for information exchange between entities responsible for providing ECM and community support services. Okay, so we can move to the next slide.
Susan, I have a quick question. There was a question that came up about for the provider workforce category, are providers limited to just billable Medi-Cal provider types, or can they also utilize broader service provider definition, including case managers, instructors for people who are blind and visually impaired, et cetera?
So I'd have to take a look at the specific question. So the question is, would they be tied to a CBO, for example, that is looking to provide ECM and community supports? And as long as they have a pathway to contract with the Medi-Cal managed care plan, they're through a CBO, or entity that qualifies to contract with the Medi-Cal managed care plan, then that would be the pathway.
Right. Thank you. Okay. Next slide.
And I just saw, it's hard to track all the questions, but I did just see these slides can be made available afterwards, so happy to share them. So just really quickly, we've gotten a lot of questions about retroactive funding. So I did just want to mention that, we launched CITED last year, August of last year is when we launched CITED. And we really wanted to make some allowances for entities that have already invested in capacity and infrastructure for ECM and community supports. And our expenditure authority under CalAIM really began January 1 of 2022. So we are allowing for some retrospective funding, but there are some very specific guardrails. For example, one very specific guardrail for cited funding generally is that funding requests can't be duplicative of other funding. Basically just saying that you can't pay for the same thing twice, right? So that's just an example of the type of guardrails that are in place. But if you have any specific questions, as I mentioned, we do have a lot of information on our website. We do have a cited guidance document that's linked here. And later on in the deck, I will provide email link for specific questions I can provide to our third-party administrator that is supporting us, and a phone number that you can also reach for any support in your cited application.
Right. And then Susan, I just wanted to note just one other thing. Somebody asked the question of whether, if they reach out to the TA marketplace and they would they be able to get advice from the TA provider as to whether their organization and the services they provide would be eligible to apply. So they basically want to get input. And then the second part of the question was, do they have to pay for the TA? And no, it's free.
Okay, yeah, no, the whole idea of the TA marketplace is that there's funding available. So if you go to the marketplace, you find a vendor, you work together on a project, you submit an application for that project, it will go through a review and approval process, and it will be funded through the path dollars. Okay, so I recognize that there's still quite a few more slides. I did want to just highlight a couple just really quickly. So first cited, there is some it's application based, right? So there is some application information that's needed from applicants, really specific to what are the dollars that you're requesting, what's the intended use of the cited funds. There does need to be a detailed justification for what the funds will be used for and how it ties to building capacity for enhanced care management and community supports. The other piece that's needed for the application is a description of milestones and deliverables for the requested funding. And there does need to be clear alignment with, again, CalAIM goals and ECM goals. And as I mentioned earlier, there does need to be attachments that reflect either an executed contract or a signed attestation from the managed care plan that the provider will be engaging with to provide ECM community support services.
Right. One quick question, is CITED round 2 funding an 18 or 24-month time period? And if it's the first time an organization is applying, does that mean that the funding cycle is 24 months on a fiscal year cycle?
I'll have to look at that. I mean, we don't have, you can include, it can span multiple years. I'll say that. And so it needs to be tied to milestones. And I think what you might have seen in the 18 months is really related to the workforce, as we don't want to necessarily be paying for staff, for a very long time. So there is a limit in terms of workforce and the time period there, but it can span multiple years, but again, it has to be tied to specific milestones.
Great. And the final question is there still an opportunity for vendors to apply to be part of the TA marketplace?
Yes, there is. I don't have the deadline handy, but we're having multiple. The first slate of vendors, we had an application window, but now we do have a process by which, if you want to raise your hand and become a vendor, we're taking a look at that and adding potentially on a rolling basis, because we want to make sure that folks have access to a variety of vendors in different domains.
Great. And we will post the link to DHCS website for more information on how to apply to be a TA vendor. So, do you want me to move to the next slide, or are you still?
I think I just want to skip to, let's go to slide 32. So I want to just share the goals of round 2, which, there's a limited number of limited dollars that we can make available through CITED. Our first round of applications, we had a request for over $500 million, so it was really a lot of interest. And so we had to make, and then we ended up awarding $207 million. Under round 2, we have certain funding goals, and the way we are, structuring those funding goals is really, we're taking a data-driven approach, taking a look at, okay, where are ECM and community support provider gaps in this state? Where is there potential gaps in terms of utilization of our Medi-Cal managed care plan members? So really taking a look at that. And then, looking at what happened under round 1 as well, where there's interest and where there's gaps again. So, based on that, and then we're also, of course, feedback from our collaborative planning groups, as well as listening sessions that we've been having, and then input from stakeholders have really been very helpful for us to understand, implementation pain points, if you will, and also where there's where we need to kind of structure our round 2 goals. So for round 2 goals, we really do want to make sure that that there are, as I mentioned before, where we can ensure that there's providers that are providing services for children and youth. We're going live June, July of 2023, and there is a gap right now for ECM providers that are really focused on children and youth. And then there is also opportunities for us to really increase the number of community support providers that provide the community, the nursing facility transition specifically, and then also ECM providers that are focused on populations of focus related to adults who are at risk for institutionalization and folks who are in nursing facilities and can transition back to the community. So those are some areas that I wanted to highlight.
Great.
Okay. Yeah, and so this provides really quickly the application period, and then the next slide provides the additional detail on just really helpful resources, including the guidance memo. And then there's some really good webinars that you can, hit play and listen to. And then this is the email and phone number that will be that's available for you to reach out to. And our third-party administrator is available to answer questions and also to support you as you're thinking about your application, questions you have, and even through the application process. And with that, I think I will close out.
Thank you so much.
Thank you very much, Susan, for being so generous with your knowledge and that you've gained over this short period of time. And please extend our thanks also to DHCS Director Boss and our State Medicaid Director, J.C. Cooper. This is just a tremendous amount of work. We're so proud of what California is doing, and we're eager to be a part of it, which is why we're holding this webinar today. And I see from the list of participants, we have so many of our partners from the AAA network, from the Independent Living Center network. We have CBAS providers and MSSP providers on. We have CBOs. Our community, aging and disability community, has turned out for this call. So thank you. Now I'd like to turn it over. You heard a bit from Sarah Steenhausen. She is the Deputy Director at the Department of Aging, and she oversees our Division of Policy, Research, and Equity. Sarah is going to facilitate a discussion with a few of our, the first round of funded entities that we're proud to share with you and introduce you to. Sarah, take it away.
Great. Well, thank you so much, Susan. And thank you all for being here. Susan, Philip, that was an incredible presentation. There are a couple of questions in the Q&A that we have been answering, but if you want to chime into them while our guests here are providing their input, that would be wonderful. So thank you all for your questions. And I'm so pleased that we were able to reach out to our key partners in the community who have been successful in applying for and receiving CITED funds. And they just wanted to walk through how they went about it. Really high level overview, because we want to leave at least 10 or 15 minutes, 10 minutes really for questions. So first we will hear from Victoria Jump, who is with the with the Ventura County Area Agency on Aging. And then we are very fortunate to hear from Dustin Harper, who is the Chief Strategy Officer at the Institute on Aging. And then finally, we will hear from Eric Hazard, who is the Senior Director for the Community Care Hub at the Partners in Care Foundation. So welcome to all of you. And, I think you've seen a lot of the questions that have been coming up from our participants are how and whether they might be applicable or an entity that is eligible to apply and receive CITED funding. How do you go about doing it? And what are the services that you're providing? So if you could just provide a high level overview and talk about how the process went, that would be very helpful. So Victoria, we will start with you.
Thank you, Sarah. So we are an area agency on aging and also an aging and disability resource center. We do currently provide 2 of the state Medicaid waiver programs. For us, it's a fairly easy process. What is asked is not too extensive. We provide for under CalAIM, we're currently providing enhanced care management for individuals at risk for institutionalization, as well as those wishing to transition from facilities back to the community. For community supports, we're providing the medically tailored meals, the medically supportive food. We provide the nutrition counseling, respite, personal care, homemaker environmental adaptation. When we started looking at what the cost would be to stand up a program and really not lose money, we jumped at this opportunity when we knew that the funding was here. We wanted to make sure that our costs were covered, that we had some cushion between hiring and onboarding and training staff and having a full caseload, because once you become a provider, you don't overnight all of a sudden have a full caseload where your costs are covered. So we knew that we wanted to make sure that our costs were covered. So we did apply as part of a collaborative. So I'm a county agency, and our Ventura County Healthcare Agency, who houses all of the, the healthcare hospital system, they were the applicant. We met with them several times. We told them what our needs were, really going over what Susan was talking about earlier, that what goes into an application. So what do you need the funding for? What are you going to do with it? What are the milestones? And so we talked through that whole process. The healthcare agency was successful. They received 5.8 million in path cited in round one to do a number of things. There's a separate project in that relating to the whole IT, infrastructure and connecting all of our systems and what has to be built to be able to, receive information from the health plans and push information back to them. Of that 5.8 million that was received, our direct allocation as an area agency on aging is a little over $1 million, which will be, for the next year and a half. So when we're looking at it, and I would say for those, that are on this webinar, thinking about what you really need to do to cover your costs. And there were things that, Susan did mention in her slide. So we made sure that we had, the computers and all of the stuff that goes with computers for staff to do the work. Made sure that we had funds for training our staff, but also the referral agencies that would be submitting referral to us. We made sure that we had funding for a program administrator who's going to oversee all of this work, who really is tasked with building the infrastructure, who will train and supervise staff, convening all the meetings, looking at developing the whole referral pipeline for how you, identify, your participants, what your program workflows look like, writing all of your policies and procedures, doing all of your outreach, working with partners. And so all of that important work, when you think about standing up a new program, we made sure that we built in that cost so that, that we had somebody dedicated to do it and it wasn't added on to somebody else's responsibility. So really it's a dedicated people to do this. And then finally, we also asked for funding for a billing specialist who really is going to do that, set that whole billing, system up for us for both our ECM and community support.
Thank you so much, Victoria. That was super helpful just in kind of breaking down how you were able to go about the application process and what the funding was for. So I'm really pleased now to introduce Dustin Harper, as I said, who is the Chief Strategy Officer at Institute on Aging. And welcome, Dustin. Thank you for sharing your experience with the path-cited funding with us.
Thank you, Sarah. I appreciate it. And thanks to the state partners for pulling this together. Institute on Aging is a CBO. We're an ECM provider and a community supports provider. Been working in the CalAIM space for a little over a year now. Had the good fortune or bad luck, depending on how you look at it, of being in kind of that first wave of transitioning some of the whole person care initiatives into CalAIM. So we've been a guinea pig on a few fronts, I think, on this experience. But at the end of the day, we're a big believer that the health plans need to significantly level up their investments in social determinants of health and specifically aging and disability services. So CalAIM is the opportunity to do that. But participating in CalAIM as a provider is not easy, and it's not easy out of the gate. And so I think my fundamental message for today would be, if you're interested in being a CalAIM provider, you should be applying for path-cited funds, if there's any interest at all, because there are barriers to work through. There's startup elements to get past to be successful as a CalAIM provider. And I'll just be clear, from our vantage point, having been in CalAIM for a little over a year, without the path funding that we've received, we'd probably be more in the mode of shutting down some of our CalAIM programs rather than trying to expand or ramp them up. So it's a really essential ingredient to make this combination of policy efforts come together, I think, because the health plans are also trying to learn as they go. And so the health plans are in a place where even the most well-intentioned ones are trying to get the nuts and bolts in place, which means some of the volume's not there, some of the things that we imagine will be there when we get to a more mature market aren't there yet. And so the path helps us get through some of these early stages. So Victoria talked a little bit about startup challenges there. That was another area of focus for us. We also focused our application a lot on systems, and there's a number of systems requirements. We're trying to do this work across a few different regions, and most of those regions have different regional data exchange requirements or collaboratives that we're trying to participate in. Our electronic health record has to be upgraded to facilitate the claims and billing processes and be able to integrate into the health plan systems more seamlessly. There's also a little bit more of an expectation around data security. So we've improved some of our systems security capabilities as well. There's also an element of trying to imagine where we think some of this will get in a few years, where we want to make sure that CalAIM doesn't create what my colleague calls a race to the bottom in terms of quality of services that are provided, right? We're trying to make sure that there's a floor around what quality services looks like here. We've had a lot of experience in this space and are fortunate to be NCQA accredited. And so to maintain that accreditation, to maintain those standards requires some costs and investment, and trying to perform at a level that requires investment, which we've been able to get some support from through PATH. I mentioned we are an ECM and community supports providers. We do a handful of them, but our specialty really is around nursing home transitions and diversions. One of the community supports in particular is around assisted living, transitions to assisted living. Something that we've done in our whole person care and previous projects has been around trying to build out networks of assisted living facilities that managed care plans could rely on as alternatives to institutional settings, an alternative to the assisted living waiver. And so that's an area of focus within our PATH proposal as well, to try and build out that capacity as more plans start to develop readiness for that service area. So plenty more elements and pieces to talk through with more time. But again, at this point, I think we're mostly just concerned with making sure that the aging and disability service provider network is well represented in the PATH funding and overall capacity building for CalAIM.
Absolutely, so critical. We want to see all of our community partners as part of this. It's a tremendous opportunity. So thank you for that. So Eric, last but not least, we only have about 10 minutes left. So if you want to spend a few minutes kind of building on what your experience has been at Partners in Care, as you know, we know you're leaders in this space, and then we'll have a few minutes for questions before we wrap up. Thank you.
Yeah, thanks for that. Good afternoon, everyone. Eric Hazard here, Senior Director of the Community Care Hub. I will go quickly, but just building upon everything Dustin and Victoria said, we definitely resonate with that. At Partners, we're really focused on aligning and addressing social determinants of health by aligning both that social care and healthcare. We're also HCBA, MSSP, and other state waiver programs. And we're doing both ECM and CS services, but we only applied for PATH cited around ECM. I think part of our approach was being really focused and really coordinated about what we were trying to do. And it was about an innovative kind of alignment with a coordinated regional care and arm of Prospect Medical. So it was that clinical piece. How do we do that social care well, partner with a group that is there to do that clinical care? And how do we kind of elevate and provide that coordinated approach around shared care planning, coordinated case review, and removing those silos? And I think because we focused on that, that was, you know, a unique opportunity to collaborate together and really think about pulling in other partners that are really going to make a long-term impact. Again, just something Dustin said, how do we think about the long-term approach about CalAIM and make sure we're thinking about quality and aligning to what other elements are occurring in the healthcare space, things like value-based approaches, et cetera. And so that was, I think, really great. Of course, with this capacity, it really helped both of our organizations deal with some of the startup costs, ramping up the initiative, and really kind of cemented that this was a real project, right? We had IT support components, project management, outreach, et cetera. And then during the process itself, and I think Victoria probably experienced this, we're able to do the proposal together in a collaborative, right? We're able to say, great, let's leverage your expertise for this section. We'll leverage our expertise. And that was really helpful. And then some of the elements as we're in the middle of it, we're transitioning from implementation to operation. We've learned a few things. The data sharing and coordination is critical. As other people alluded to, the health plans have different systems of record. We have different systems of record. Really making sure we're leveraging HIEs or, in this case, lanes for us is crucial. And then really, again, it's building that respect and mutual collaboration, right? As we do this work and elevate and collaborate with social care and clinical care, we have different backgrounds. And so we've really prioritized meeting with each other weekly, establishing how we do our work and how we set each other up for success. And so overall, it's been a really great process and has really helped accelerate the impact of our ECM program and thinking about long-term success. It's from our perspective, it's been wonderful. So I appreciate the time, and I'll pass it back to you, Sarah.
Wow, that was incredible. All three of you just had such great nuggets of input and feedback. So I think super helpful to hear. Would it be possible, just before we go to any additional questions, can each of you say how much the amount of funding was that you received in your awards?
We had $760,000. What was our amount?
Right. And Dustin?
I think we have an opportunity to earn up to 12 million is my understanding.
Okay, thank you. And Victoria?
Mine is a little over $1 million.
Okay, a little over $1 million. Okay, that's right. Great. So now, thank you, Susan, for joining us again. We'd be happy to take, if anybody wants to raise their hand and ask a live question, we would welcome that. And I do see that we do have one hand raised. Greg Mathis, welcome and thank you for your question. If you want to unmute yourself, Greg. Okay, I'm not hearing from Greg at this moment. Are there other questions that any of our attendees have? There have been a lot of excellent questions, and I do think that all of the resources that have been shared about the TA marketplace are a great place to start for any additional questions that you all have. I think what we're trying to encourage is just to go for it at this point. There's really no harm in trying right now. You all provide such critical services to this population, and the managed care plans need you. So that's something I think we heard loud and clear today. Susan, Phillip, anything else that you wanted to kind of focus in on or add on to?
Yeah, I think I just wanted to emphasize what you were saying, Sarah. So there's a TA marketplace, and also just building on Dustin's point on the cited dollars. Again, it's open through the end of May. So really go to the CITED website as well. There's the presentation had a specific email address. So if you have questions along the way, our third-party administrator, a couple of the team members are actually on the call listening and tracking questions that you all are raising. So in real time, they can be hearing issues that are coming up, and really they're there to support your application process, because one thing we learned from round one is that there's maybe some ambiguity. So we've tightened up the guidance, and we want to make sure that that back and forth is there to really help you submit a successful application.
Great. That's super helpful. And what a tremendous resource to have that TA marketplace available. Two last questions that are pretty focused. One is, did the vendors apply for the full salary of ECM staff or partial? What was the time frame for that? And the second is, what software is everyone using for your case management?
So real quick, from our standpoint, we actually look to ramp up and get 1 to 2 months of salary, so we can then get people up to full caseloads, because it's a per member per month. And so we really were thoughtful about, well, great, let's just get us over a couple of months where you're ramping, training, and then building up. And then in terms of the case management software, the reality is we use Salesforce, we use the portals from the health plans, and we use lanes just because we have a few contracts with a few health plans, and so it's a little bit of hodgepodge, right? Just to align.
Great, thank you, Eric. And Dustin or Victoria, anything to add on that?
Our primary care management software system is Caseworthy, and for the most part, we pursued full-time FTEs, recognizing the risk of those, after the funding ends from PATH, to be able to sustain those positions, we have to essentially have ramped up to a level of scale to be able to support them solely on the CalAIM contract. So I think that's our task ahead of us, is to see if we can actually use this capacity building to ramp up to that level.
Great, thank you. And Victoria, last but not
Sure.
least.
Sure. For us, for the case management, we're actually in the medical record, on the electronic medical record, where we do all of our charting and our and billing as well. For the salary, for some of the positions, we actually ask for full salary for 18 months. And so that will, that will help, but it just eases the burden. And also, Susan had said something about the retroactive. And so I guess my advice, if you are applying, and if you're applying to, whenever you submit your application to when you get your award, just to make sure that you are keeping track of those costs. And those hours or whatever the time, because that is potentially reimbursable.
Right. Thank you. Well, it's been a pleasure hearing from all of you. What amazingly helpful information, very informative. And now I'm happy to hand it back over to our director, Susan DeMorris, for closing remarks.
Thank you, Sarah. And thank you. Congratulations to the three panelists that you are leading the way, as you do in so many respects with your work, but that it's no surprise that you all are already working with your first round of PATH cited funding. And we hope that we can have a webinar in the future where some of you who are joining today can sit in those seats and tell others how it was done and how it's supporting your organization, but more importantly, how it's supporting older adults, people with disabilities, and family caregivers throughout the state. So thank you all for tuning in. Susan, Phillip, thank you very much. And to the TA team that's on, thank you for listening and following the chat. We hope that you'll be contacted soon by some of today's participants. And we encourage everyone who is considering this to move forward in the next month and put forward an application if you're able to, so that we can build the robust statewide CalAIM system that delivers enhanced care management and community supports up and down the state of California. Thank you all very much and have a great weekend.